Glaucoma is a disease of the optic nerve, ultimately. The optic nerve is sensitive to eye pressure and other factors where it can deteriorate over time, causing loss of peripheral vision and ultimately lead to tunnel vision or blindness in late stages. And we can't just go by any one measurement, such as eye pressure, often called the glaucoma test. When you get your comprehensive eye examination yearly, we always look at the optic nerve shape, we look at the eye pressure, some other features which can influence glaucoma and progression into glaucoma. And we have a lot of patients where we are suspicious about glaucoma, but we're not treating yet. And then some where it's very clear that the optic nerve is deteriorating, and we are treating with combination of either eye drops or laser or even surgery to control eye pressure, to slow down the optic nerve damage that can very slowly rob us of our sight. What people don't know is that glaucoma is one of the leading causes of blindness in this country and indeed in the world. And it is a preventable cause of blindness. If we can catch glaucoma at early stages, treatments can be very effective at slowing it down or stopping it or arresting it in a stage where we don't lose vision as we get older. The most common way that we treat glaucoma is by lowering the eye pressure. That's the only way that we have to slow the progression of glaucoma. Usually we start with treatment with eye drops. Daily eye drops are very effective, and there's several different types of eye drops we use. An eye drop a day or 2 drops a day can lower the pressure significantly to a point where that's all we need to do in many, many patients. Depends on the stage in which we catch the disease, and it depends on how high the pressure is and whether it responds to the treatment. There are some more interventions for glaucoma to lower the eye pressure. Again, all treatments for glaucoma involve lowering the eye pressure in one way or the other. Laser treatment can be done in the anterior chamber angle in the office with our microscopes and slit lamps. That can bring the pressure down a substantial amount as well. That can even be repeated. Sometimes it's a temporary effect for several weeks or months. Sometimes it has a permanent effect, and it can actually be repeated to lower the pressure again. If it doesn't work and you really need lower pressure, then more aggressive treatment like surgical treatment, like operating room procedures, can also be done to lower eye pressure. Well, the biggest difference between closed angle glaucoma or narrow angle glaucoma and open angle glaucoma is that open angle glaucoma is a very slow and insidious, gradual condition that we want to catch and treat for life. Angle closure glaucoma is usually a very acute attack that can be cured with the right treatment and never be a problem again very often. Glaucoma is so common now that surgical treatments have evolved to a level where we have what we would call minimally invasive glaucoma procedures, which are operating room procedures, which are less invasive than the traditional glaucoma procedures, such as small stents and things that can be put in the eye at the time of cataract surgery, for example. That could lower pressure several points, and we're often able to take away 1 glaucoma drop or 2 glaucoma drops and get the pressure under better control while we're taking the cataract out at the same time. If there's a family history or suspicion for glaucoma, of course we see people every year. And sometimes if we're a little suspicious, we'll see people twice a year. When we start treatment for glaucoma, first we want to make sure that the medications are working if we start those, or whatever treatment we decide on, whether it be laser or medications. If they're working well, we tend to see people with mild glaucoma twice a year. Make sure that the pressure is not drifting up. If it's more severe or there's already kind of advanced optic nerve damage, sometimes we'll see people 3 or 4 times a year. So it sort of depends on each individual. Everybody kind of gets customized care with glaucoma, because one person may have very mild glaucoma and the optic nerve appears very healthy and they respond very well to drops. And we'll see them usually in 6-month intervals.